Good evening to all. I warmly welcome you to our CellTalk webinar. In today's session, Ms. Aditi will be presenting the research Brain Tumor Patients Use of Social Media for Disease Management, Current Practices and Implications for the Future. Our speaker Aditi works as a proofreading intern in the content team at Renix Life Sciences, where she is responsible for content editing and proofreading. She has a bachelor's degree in English from St. Xavier's College, Mumbai, and is currently completing her master's degree in English with Communication Studies from Christ Dream to be University, Delhi, NCR. Her previous work experiences were at Digital Skillings, Pratham Education Foundation, and Children of Sahara Foundation. Not only has she worked as an editor, proofreader, and content writer, but has also volunteered with multiple organizations working for the betterment of society through education. Here at Renix, she is not only enhancing her skills in technical proofreading, but also learning basic skills of coordination and management of web content. So without further delay, I would like to call upon Aditi to take over the session. Over to you, Aditi.
Thank you so much, Yogita, and good evening once again to everyone. My name is Aditi, and I will be presenting the paper titled Brain Tumor Patients' Use of Social Media for Disease Management, Current Practices and Implications for the Future. This paper was written by three researchers and headed by Heidi McAlpine et al. This research paper will has an impact on social media and brain tumor related diseases, and it was published in the journal titled Patient Education and Counseling in 2021. So brain tumor related diseases are, like as we all know, are some of the longest and most painful ailments in the world, and the symptoms lead to both physical and social isolation, which is a huge reason as to why we need to have a research like this out in the world, so that we identify the gaps and we bridge those gaps in the future. This study is based on patients who were administered a questionnaire on an electronic tablet in the outpatient department at the Royal Melbourne Hospital in Australia. So brain tumors basically begin in the brain or the spinal cord, and they take on names such as astrocytomas, glioblastomas, oligoastrocytomas, meningiomas, etc. And the care for these patients have always been extremely complex, as they do deal with an extremely complex disease as well. Social media and online communities in a time like this, whether it be Facebook or a support site, they've always helped to manage and like transgress social care and geographical and physical boundaries, because at times not everyone can be around a hospital, not everyone stays near a hospital, or at times there can be healthcare providers who probably don't bridge those gaps that we want them to bridge. So that is where social media steps in and sort of helps us through those times. So the basic present challenge that drove the researchers to conduct a research like this was that that social media is efficient, but to improve disease and patient management, evidence-based research is vital. Which is, of course, it was conducted in a very small scale, because it is in fact a pilot study in a outpatient department in a hospital in Australia in one city, but it will still help us understand patients' problems and where to bridge gaps, basically. So the objective of the research was uh, to assess the use of social media by brain tumor patients for information, communication, interaction, or problem solving related to their brain tumor. Second, to analyze if social media use for these purposes suggests recommendations for the design of social media platforms customized for brain tumor patients. To understand if social media used for these purposes improves health-related quality of life. And fourth, to assess if social media used for these purposes improves social functioning and activities of daily living. Sorry. So the methodology for this research was basically an online cross-sectional study questionnaire investigating the use of social media and the impact of health related quality of life and social functioning targeted for patients with brain tumors. Single center prospective study centered in Royal Melbourne Hospital in Australia, as mentioned before. Study population was a convenient sample of patients with a diagnosis of primary brain tumors. Exclusion criteria was any patient below the age of 18 and younger, sorry, below the age of 18 and 18, and the inability to take the questionnaire on an electronic tablet. The demographic was anonymous and when the health data was collected. 10 social platforms were examined: SNS, which is social networking sites, blogs, wikis, microblogs, tagging or aggregation sites, virtual environments, video sharing sites, photo sharing sites, discussion forums, and message boards, and chat rooms. For each platforms, question explored the frequency of use, features used, positive and negative aspects of each use, privacy concerns, perception for the benefit for social connection, assessing useful information, sharing experience, and motivation. So a 5-point Likert scale was used. For example, I'm sure we've all participated in ethnography-based surveys at some point in our lives, especially in the present times. So it usually has questions of, I prefer to remain anonymous on social networking sites, and the options go from strongly agree, neutral, then disagree and strongly disagree. So that's a 5-point Likert scale, which was how this research was conducted. A cutoff of 75% of users expressing a preference, agree or strongly agree for any item on the questionnaire, and which was chosen to make recommendations to guide the construction of future online platforms. So the health-related quality of life was assessed through the functional assessment of cancer therapy brain version 4, which is also called a FACT-BR, FACT-BR. An initial pilot study of 23 participants was undertaken to assess the questionnaire design, and changes were made thereafter. And as a person who's actually conducting her surveys of her own, I strongly support that, because a lot of times questionnaires can be taken the wrong way, and it is a very good step to really assess if your questionnaire will do well, and get a mini pilot study or a run through before you actually do your entire study. From the order of the questions to the wording, changes were made accordingly. Patients could also decline to answer a particular question, and the final study was consisted of 224 participants, including the 23 participants before. So the results were some of the very initial statistical results, and there were many more than this, because there were huge conclusions made on the from everything from the demographic to how far they lived from the hospital, and if they were partnered or not. So 249 patients were approached and 201 agreed to participate. 49 patients declined for a variety of reasons, including poor health, disability, or stress, or on advice of their family. Of the participants, 123 on 201 were aged between 30 and 59 years. Then 112 of those 201 people were female as well. The majority of the participants were not working for pay, so they were basically unemployed. And of those not working for pay, reported that this was primarily due to ill health, like they just could not go to work, which is why maybe they had to quit their jobs or just stop working as a whole. 84.5% of the participants used the internet, and 70% of those looked up information about brain tumors. 90.5% of participants who used the internet also used smartphones, and 86.8% of this number were comfortable using it. Among the people who used the internet, 70.6% of them used social media. Almost all 10 social media listed were used by at least some participants for support, communication, problem solving, and information. And only these participants were included in the final conclusion, because that makes sense. Social networking sites were most frequently used, 33% of them, followed by wikis, which was 28.1%, blogs 14.0%, and other platforms, which is less than 10%, but they also had a good standing in the population through which the research was conducted. 73.6% of the participants who used social media used at least one form of social media for self management of their brain tumor. Top three most common social media sites were taken, and the participants were asked about the features they value, and including the areas of privacy, flexibility, contributions, and functions. Social networking sites, which was 33.1% of social media users, and 19.9% of total participants. They used it for content sharing, liking a post, updating status, and private messages. So SNS was basically used for people for a more like sorry, not private, personal agenda. Whereas wikis, which was used by 28.1% of social media users and 16.9% of the total participants, they use it for self management and problem regarding their brain tumors, which is what we also use. Normal people use wikis for. So even patients, when they were surveyed, used wikis for uh, problems and for googling problems and information regarding their brain tumors. Blogs, which was used by 14.0% of social media users, 8.4% of the total participant, used it for self-management of problems regarding brain tumors. And the rest, 33.8%, used other forms of social media through video sharing sites, discussion forums, photo sharing websites, virtual environments, etc. Of the 201 initial participants, only 132 completed the optional fact BR questionnaire due to fatigue, as it was a huge questionnaire. Of those who completed the fact BR, 78 used social media for information, communication, or interaction about their brain tumor or for problems related to their brain tumor, and 54 were social media non users. The questionnaire included a number of questions related to participant perception of the benefit of social media on the social functioning and activities of daily living. A positive impact of daily SNS use was reported, including taking in new information, enjoying life, and participating in social activities, which is also what we know social networking sites are used for in today as well, through for most people with not a similar disease or anyone else as well. Wiki users did not report any meaningful improvements. Blog users reported improvements relating to managing emotional burdens and anxiety related to their diseases and taking in new information. So I feel wiki users mostly used those websites that they used for information. So which is why they did not look for any emotional support through that. Whereas blog users, there are very wide arenas when you go blog exploring basically on the internet, which is it can lead you to emotional support blogs as well, which is why it can help you manage emotional burden even if you're not looking for it. So that is why I think where the difference comes in, although their goal was the same as we read before, because wiki and blog users both used it for informational support. So this was the questionnaire, and these are all the statistics and the percentages. So you can see that some of them really like less than once a month. Most of the users used their internet about less than once a month. How often in each platform is used for information, communication, or interaction about your brain tumor? Less than once a month was a lot of their responses, like 55%, 58.8%, and 47.1% answered once a month for all three. So prefer to use this platform only when people I interact with are online at the exact same time. Was neither agree nor disagree, because I'm sure a lot of them used it for, uh, as we discussed earlier, that they used it for information sharing and emotional support. So of course, not everyone was looking for someone to be on the platform with at the same time. Mhm. Value being value being able to find out were you being able to find out about others' experiences through this platform? And a lot of people said agree, because of course there are a lot of support groups, like we discussed earlier, that can emotionally help you out and with problems and with like just general questions that one might have during a time like this. So as we move on to the discussion, widespread use of online networks and a small number of brain tumor specific social media groups or communities tell us that patients were indeed turning to social media for support and information. The demographic data basically depicts that the population that was dealing with brain tumor related diseases were in fact geographically and socially isolated. Three of the most commonly used platforms, SNS, Wiki, and blogs, suggest that patients aim to seek out both active communication and encyclopedic information along with anecdotal information. There were many suggestions and recommendations for study population for further use of social media as well. This study was also concluded that health-related social media use was not sufficient to bring about improvement in emotional well-being, because of course, as we all know, that not everything can be solved by social media. Of course, you can have emotional support, but that emotional support will only be for 5 minutes or for 10 minutes or for even maximum to an hour or two a day. But at the end, for people who were not partnered in the study, who would they turn to physically? Because if they did not have anyone around, they could have all the emotional support they want online, but as soon as they switch off that phone, or they switch off the TV, or they switch off their tablets, they have no one to turn to, and there are no healthcare providers with them as well, because they lived far away or they did not have anyone around them. It may be that the current study was underpowered to show a difference, or that no such difference in health related quality of life results from social media engagement. It is also possible that unregulated platforms are not specific enough to the needs of brain tumor patients to elicit an objective difference in health related quality of life. Uh, with social media, I think there are a lot of times where it's just support groups. There is no as such healthcare professional on it to really give you the emotional validation or emotional support that one might need in a time like this. So because you can get the emotional when there is some sort of validation in someone saying, yeah, it's okay, but at the end of the day they are not medically qualified to tell you that you are okay, or it's going to be okay, or that you should do something a certain way. So of course it is understandable that social media use cannot really manage or balance out health related quality of life or improve it in any way, because that's not its purpose in a way. And even if it is, I don't think it is a very fulfilling or a possible purpose in this day and age. Of course, technology can become more advanced in the next 20 to 30 years, and it is possible, but I don't think it is now at the moment. So the limitations of the study are the study only included brain tumor patients. However, their caregivers would also have been a useful addition for future studies. Um, I am very confident that this is actually, as soon as I read the paper, this did come across my mind, and the researchers themselves listed this as one of their limitations, because their caregivers are the closest to what is happening, and healthcare providers are the closest to what is happening, and um, how patients with a disease like this recover or they go through it. So I think including them in a similar sort of survey and comparing it would have been a better, would have come or would have concluded to a better result. But yeah, that was one of the limitations even the researchers admitted to. And that this was a pilot study and surveyed a very extremely mixed group of diseases. Of course, as we read in the one of the first slides, that there are many sorts of brain tumors, and they all deal with many different symptoms and like quality of lives basically. And some could be malignant as well, and some could be benign as well. And not every person can have the same experience with their disease as the other, even if they have the same term related to them, which is brain tumor. And that's not even fair to, like, it's not fair to have a study that completely clubs everyone together in one pool. And that this was a pilot study, it could have been a larger study, but of course it kind of helped us understand what the needs of such patients are. And it helped us understand that there is in fact a group that genuinely does need everyone's help, and social media can be more efficient, and healthcare providers can be much more hands on in the future. So this study basically showed that a specific group of patients does need extra care and support, as I mentioned. This kind of research also helps in understanding the preferences and affordances of social media and its impact on health related quality of life. It also helps the healthcare and information providers better understand where they lack and where the gap in emotional and informational support is for patients with brain tumors. The impact of this research was that clinicians were informed, and discussions on creation of future disease-specific online platforms are in place, which I think is a wonderful step, or it will be a wonderful step in the future, as this study is pretty recent. I'm sure we do. There are a few websites that do support that kind of that provide that kind of support, but I think it should be more efficient, and it should be louder for future generations and for future patients and current patients. Patient support, informational needs to be upgraded and developed more, not just online sites, but people living in geographically remote places and are non and which are non and who are non-partnered should be provided with proper social and medical care, so they do not like need to travel 50 or 100 kilometers just for support, because that is absolutely preposterous. If someone is dealing with such kind of diseases and the symptoms that come with a disease like this, of course need special care and need hands-on treatment. And I think a research like this like genuinely screams out that this is a pool of people that need our help and need better upgradation for not only healthcare, hands-on healthcare, but also social media, like medical care provided through social media. Thank you so much. You can find me at aditi@renix.org if you have any questions or comments. Thank you.
Thank you so much, Aditi, for this educative and informative talk. Now I open the floor to the audience. Nupur has a question. Do the users cross-check the information? Sometimes misleading information is also posted on social media sites. Do the users check the information with doctors or other professionals?
It's not mentioned in this study, but I'm sure some do, because of course, like I said, it's not mentioned in the study, but there are times and there are people that I have seen as well that if I get to know something on the internet, I would, if I do go to the hospital, I would cross check with the doctor that I have been put with, as that is, I think, very important. And I'm sure they do too. But if they don't, I it is pretty harmful, because you cannot really you can't say that every information on the internet is absolutely 125% true, but I'm sure they should, because the people around me do and I do, and being a former hypochondriac, I definitely do. But yeah, it's not given in the study, but yeah, let's hope that patients do actually take that step forward and ask the doctors if something or a site actually is uh, is reliant enough to follow.
Hope it clarifies your question, Nupur. Next question is from Vijay. Was there any data about correlation of amount of time spent on SNS and improvement in patients' outlook towards disease and positive state of mind?
Uh, No, I don't think there was any question that related to the amount of time spent, but for the quality of life and how that affected them, I think it was related to the fact BR that was the health related quality of life questionnaire. But like the data mentioned, I don't think there was a difference. Like social media didn't really impact the patients in through with their health related quality of life. And yeah, I do not, but to the first part, I don't think there was any question that related to their time spent.
Hope it clarifies your doubt, Vijay. Next question is from Numer. Is a better personalized and humanized approach more beneficial for individuals experiencing health difficulties?
Mhm. Sorry, can you repeat that?
Yeah, sure. Is a better personalized and humanized approach more beneficial for individuals experiencing health difficulties?
I think it is, but um, I think after COVID, we have all sort of switched to social media and we've all sort of switched to online resources to help us out. Um, I would love to say that it is, because I myself urge people to go to the doctor if for any slight inconvenience. But at the end of the day, I think social media can be better. It can be better, and once it is better, that is when a humanized approach sort of balances out. And I we can even try and say that it's not better, but we can try and say that it's not better than social media and a medical approach through social media. But at the end of the day, yeah, at like present day, her humanized approach will be better.
Next question is from Bharati. Will teleconsultancy through social media also gives negative impact?
That is a question I don't think I am qualified to answer. I don't know the statistics to that. I don't know if someone has faced any negative like implications for that as well. But I do know that it has helped a few people out during COVID, because of course there were a lot of people, the lot of times we could not go out. But I'm sure it's become better. But I do not know about negative implications. I'm really sorry.
Thank you, Aditi, for answering those questions. Is there any question from anyone? I think there are no more questions coming from the audience. So again, I want to thank Aditi for the excellent presentation. I'm sure all of us can have a takeaway from this. Before we conclude this webinar, I would like to inform everyone that our next presentation will be on 8th Feb 2023, and Diba will be presenting research titled Prognostic Factors Associated with Survival in Patients with Diffuse Astrocytoma. I would like to thank you all for your time and kind attention today. Thank you all for being here. Hope to see you all at the next presentation. Thank you so much.
Thank you, everyone.